Good afternoon, everybody. And this is the monthly health program going around for the past 3 years. And today is the World Patient Safety Day. Environmental measures needed to safeguard the patient in the healthcare facilities. This is what we are going to please come. We are going to talk about it. And to officially welcome Professor J. Srinivasan. He is the founder of this institute, and he has the editor of the IPCC report for the 186 countries globally, and he is a special professor and on the oceanic science, atmospheric science. And today he has got a monsoon program at 3:30 p.m. He's always every week program. This is the last program he's been having it. And what I know him is a man. It's simple, less speaks, and always encourages academic field and stand by the side of them, guides them. And also he's a man, what he preaches, he practices. There's something great about it. We always tell about that we have to reduce 2 tons of carbon footprint every year to match up with the global carbon footprint. And he practices that. How he works, his house is Malaysia, he walks every day. And by that he saves everything. And also shopping, also you don't go with car or anything like that. He walks there on bicycle. Inside the 1.5 kilometer, he comes in the bicycle. This is the person what we have, J. Srinivasan. And many times he don't accept it. He has earned his name working in NASA and all the in USA. His uncle is none other than Nobel laureate Sir C.V. Raman. A great pleasure requesting him formally introduce the speaker today. Over to you, sir.
Good afternoon. We have this program normally on Thursday afternoon, but this Thursday is a holiday, so it has been shifted. And because of the conflict with another seminar 3:30, we are having it earlier time. And Dr. Parmesh has always managed to invite the best doctors to come and talk on various issues related to health and environment. So today we are lucky that Dr. S.V. Shivaram is here to tell us about environmental measures needed to safeguard the patients in healthcare facilities. So I request Dr. Parmesh to introduce the speaker.
Once again, good afternoon. On behalf of the Divecha Center Climate Change and Lakeside Education Trust and International Pediatric Association, representing 1 million pediatricians in 150 countries, they're all going to be measured and all things. So on behalf of them, I welcome you all this program. And this is the topic I mentioned about it. We have 2 special guests to hear about it. We have a pilot, Mr. Mittal. ISRO, a lot of scientists he flew with them and all the things. He's a single plane pilot, and his wife is also there, ma'am. So both are all tennis players. His son is also pilot. Another son is RV College management. He's also a tennis player. They're very good tennis players. Anyway, welcome to the program, sir. And today's topic is the, as you mentioned, World Patient Safety Day. Why we have to consult about it? This program is always on the 17th September. 17th September is the World Patient Safety Day. It is established in the year 2019, May, during the 72nd WHO program among the 11 important global public health issues by the WHO. Since the origin, there will be a theme for each year. Like in the year 2009, patient safety, a global health priority. In 2020, health worker safety, a priority for patient safety. In 2021, safe maternal and newborn care. 2022, the medication safety. 2023, engaging patients for patient safety. This is a call for all stakeholders to incorporate patients in policy creation, in safety initiatives, healthcare administration, and self-care. We health professionals need their safety too from violence in the hospital by the policymakers. To talk of these issues, we have none other than one of the famous doctors we have with us, that is Professor H.V. Shivaram. He did his MBBS in my medical college, Mysore Medical College. We are celebrating next year centenary. That the first medical college in Karnataka state is started. And he is a gold medalist. He did his MS in general surgery in Bangalore Medical College. And he has his FRCS in Glasgow and FICS in India, USA, and FMBS India. He is currently the head of Department of Surgery and Allied Sciences Program, Director of Bariatric Metabolic Surgery, Director of Academics and Education in the Aster CMI Hospital, Bangalore. He has about 33 years of experience in surgical profession, in teaching, in training, and in research. His skills in gastrointestinal tract, that is laparoscopic surgery, are very well known. He has published research articles in Index Journal, delivered many orations, and authored chapters in surgical books. He has served in the Army Medical Corps as a captain and was awarded Sainya Seva Medal, also received Doctor of the Year Award 2017, and also Rotary Gold Medal Award in 1999, and Dr. Professor Mahadevan's Award in 1997. He is a surgery postgraduate teacher for National Board of Royal College of Surgeons and has trained many surgeons across the country and infused those abroad gastrointestinal and minimal access surgery. He is a member of the various national and international professional bodies and executive committees, both at national and state level. Currently, he is the president of the Karnataka State Chapter of the Association of Surgeons of India. His passion, other than surgery, includes travel, trekking, mountaineering, and writing various subjects and travel. I think it was in this July 30th, we had the VHS Center and the Lakeside Education Center. We had a 41st annual CME program. That morning, he arrived climbing the Kilimanjaro hill, a mountain from Africa. Morning he came, in the evening he came for the dinner because we were working together in Lakeside Hospital. We came together, and this is what his commitment. When he says, he always does it. It's a great pleasure. Welcome to you, sir. Over to you. Thank you.
Thank you, Dr. Paramesh, for that wonderful, lengthy introduction. Most respected Srinivasan sir, and all the audience gathered here. It's a great pleasure and also proud moment for me to get invitation from such a prestigious institute, and also from Dr. Paramesh, who is a mentor to all of us. So I worked under Dr. Paramesh in Lakeside Hospital. Wonderful person and a wonderful hospital, and we had a very good group of doctors that time. We all worked together, especially for patient safety and for the good of the people. So it's very apt today to speak on the environmental measures needed to safeguard the patients in the healthcare facilities. Sir has already introduced the topic. I bring greetings from the Aster CMI Hospital, one of the most well-equipped and tertiary care hospital where all facilities are available under one roof. So what is patient safety You may be wondering, were all patients when they go to the hospital or healthcare, they are safe. But the situation may be different in different places. So patient safety is constantly working to avoid, manage, and treat unsafe acts within the healthcare system. Use of best practices and safety culture in all the healthcare facilities and aiming at optimal patient outcomes. So this is what is the patient safety we are talking about. So just to remember easily, we have all the letters with a mnemonic. S for sense the error. So be careful, and many times you can act to prevent such errors. Follow safety guidelines. Inquire into say accidents, deaths. One of the most important problem in healthcare system is if there is a small mistake or anything, it may go unnoticed or may not be reported. But we want it to be reported so that we can learn from it. Take appropriate measure so that such mistakes or errors won't occur in future. So whose responsibility? Patient safety is responsibility of everyone. You, me, and doctor or patient or relatives, everyone is involved in this patient safety. To err is human, we all know about it, but to persist in error is diabolical or illogical, and it may create more harm. So you have to correct it and then move on towards the healthcare facilities. This is a landmark publication which was published in 2017, which opened everybody's eyes, including the World Health Organization. Your healthcare may kill you, the medicine errors or medical errors. So at that time, there was a lot of activity, lot of learning, and also a lot of noise, so that how this can happen. That too in the United States of America, the maximum errors are medical errors, the third leading cause of the death. So that was very, very shocking for everybody. So since then, WHO has taken it very seriously. There were global actions and organization changes everywhere occurring. So healthcare facilities are not as safe as everyone thinks. So we may think once you go to hospital, doctors will take care and everything will be fine. But we should realize that hospitals or healthcare facilities are people-intensive places. There are so many people, sick people round the clock, 24 hours, 7 days a week. Public have access to enter hospital anytime and from various entrances. Even though that's regulated, people insist that they should enter the hospital. Atmosphere is filled with emotions, excitement, happiness sometimes, death, sorrow, all emotions you can see inside the healthcare facilities or hospitals. Hospitals operate under continuous strain. That's because it can give rise to irritation, confrontation, conflicts, aggression, litigation, ethical issues, so many things under one roof. So you must think that healthcare facilities, when we enter, we have to be very cautious and protect ourselves also. So why patient safety initiative? I have just already given a clue. Every point in the process of caregiving contains certain element of inherent unsafety. Just like when you are crossing the road, when the green light comes, you may think it's very safe, but there is an inherent risk because somebody may suddenly jump the traffic and may come. So similarly, approximately 1 in 10 patients is harmed while receiving hospital care. Some of them may be very simple ones, may go unnoticed, but one of the 10 leading causes of death and disability in the world is due to unsafe care in the healthcare facility. Third, the first one is the cardiac issues. Second one is the cancer. And third is the unsafe healthcare. So that is the third leading cause for death or disability all over the world. That's why, as Sir said, 17th September is celebrated or observed as the World Patient Safety Day all over the world. So that is come from the 72nd World Health Assembly, which adopted the resolution Global Action on Patient Safety. So you can imagine how big is the problem. Whole global action it is required. A simple action in a small hospital or in a clinic is not enough. So that's why we observe this World Patient Safety Day every year, and a lot of activities happen during that time. Objectives of the World Patient Safety Day 2023 are about fourfold. That is, raise global awareness. So one of the talk I think Sir has kept, because to create awareness about the patient safety, engage policymakers, healthcare leaders in the patient safety, engage the workers, organizations, voluntary organizations or civil society and other stakeholders, empower the patients and families. This is very important, that we should ask them to or allow them to ask questions, raise questions, and make them empower not only the patients and also families. Advocate urgent action and patient and family engagement. This advocacy is also very important, which goes a long way in making the patient's health safe in the healthcare facilities. Elevate the voice of patients. So we should not ignore any small complaint from the patients, when not only about the health facilities or anything, or the medication errors or the treatment errors. So engaging the patients for patient safety. Nowadays, we explain every step of the healthcare, what they are undergoing to go, whether it's a surgery, anesthesia, or anything. Everything has to be explained, because this is a totally new thing for the patient. So when we say hospital safety, what we are looking at? We are looking at people, place, and also the property. 3 P's. So people, place, and property. So that if we cover all the 3 things, then we can say that environment is safe for the patients. Safety of people. So when we say people, there are hospital staff who are actively involved in patient care. There are visitors of the patients, and most importantly, the patient himself. So all these people have to be taken care, and we have to ensure the safety of all the people who are in the healthcare. So when we say the place, the second P, it is the infrastructure of the healthcare, and the fire safety, and a lot of electrical, mechanical work will be there. So those are also should be very safe. Safety of the property, that is, when we say hospital, there will be a lot of assets, there will be a lot of stores, medicine, IV fluids, equipment, all these things. So all those things should be safeguarded when we have a healthcare facility or a hospital. So considering all those things, so if you say the environmental safety in a healthcare system, it involves lot many things. Medical safety, surgical safety, electrical, laboratory safety, sanitation, again, very, very important, infection control, and the biomedical waste disposal. So these are all very important safety aspects. And the blood safety. So blood is also, blood bank has a lot of regulations, equipment, installation safety. So all these things, so many things are involved when we talk about these hospital or healthcare facilities, environmental safety. So to safeguard these things, basically most of the good healthcare systems, there's 5 strategies they usually adopt. That is, one is nurture a patient safety culture. The patient safety culture will not happen in one day, 1 month, or 1 year. It's a very continuous process, and people should be involved from the head of the institution up to the lowest category also. You can imagine, if you are not trained a proper ward boy or a person to shift the patient from the ward to the OT, he may not do a proper job. Patient may fall down or he may get injured when shifting or so. So that patient safety culture is very, very important to establish. Identify and work on mistakes. So this already I told, errors can happen. So error is human, but report it, identify it, and work on how to prevent it. Reduce chances for human error. Human error keeps on happening, but we should have robust processes there so that this can be reduced. Ensure a clean hospital environment. So that's again very, very important. Clean environment. You might have experienced the hospitals which were there about 1 or 2 decades ago. What we see now, they are entirely different. Ensure accurate patient identification. So we should not wrongly identify and give wrong treatment to a patient. So that's how, if you see here, we do what is known as the site marking. So wrong eye should not get operated. A wrong limb should not get operated. So we make a marking when they go to the hospital, operation theater or anything. Right patient should be identified. So we have a lot of bands now we put into the patient's hand, and the staff also they call out loudly the identification number and the patient name, confirm with the patient. So there are a lot of checks and balances which happen so that patients are not wrongly treated, and all these 5 strategies are properly applied. That is definitely going to help. So environmental safety of the healthcare facilities, and this list is endless. Adequate light in all areas, adequate ventilation, exhaust fan or air conditioning, stairs with the handrail. Each small point is very, very important. Window door closures, slip preventing floors, fire extinguishers and fire alarms, noise pollution prevention, heavy and comfortable cots, beds, they should be comfortable to the patient, safe wheelchairs and trolleys, small things, but they are very, very important. Safe bathrooms, toilets, call bell system for patients, adequate signboards and security system. So the list is endless, and we can add n number of things so that the hospital or a healthcare facility environment can be made safe to the patient. So that's why if you see the global action, there are so many steps, so many rules which has to be applied, and they take a lot of initiatives, new initiatives keep coming every year. Coming to the types of errors, there are many types, but I'll just give an example of one or two. One is the adverse drug reaction. Any drug can react because each patient is a different person, different physiology. So we always give a test dose or a small dose and then give the proper injection. Still, unpredictable things can happen. Medication error, again, there are problems of wrong patient, wrong medicines, or wrong dosage that has to be prevented. Sentinel error, this is one of the grave problems in the healthcare system. Doing surgery on the wrong body part. The right limb has to be operated, but if there is no proper identification, everything, left leg may get operated sometimes. Right eye or left eye, wherever there are two things. Surgery on the wrong patient itself. There may be sometimes same name patients, 2-3 patients may get admitted. So again, we have to be very careful. That's why this handband number, identification, everything is very important. Patient receiving wrong medication. Again, there are medicines which look alike or sound alike. So those things are also very carefully taken care of. It's not important who made the error or whose error it is. We don't go on finding fault with the patients. What we have to do is the correct, to do a root cause analysis, why it happens. Ultimately, it all leads on to correcting the process and the system. If that is right, then the errors automatically get reduced in the healthcare system. Medication safety, if you see here, two important things are there. Before you give the medicine to the patient and before the patient takes the medicine. So we have to know the medication, check all the things, patient, medicine, dose, name, everything, and ask if you are the patient, your patient, if they understood what the nurse or the caregiver has explained. Similarly, before a patient takes the medicine, they should know what they are taking, check, and again ask the nurse if required. So 5 things are important. That is right drugs, right patient, right dose, right route, and right timing. So these are all very important to be ensured. So the medical safety again has so many things. One of the most important problem was illegible writing prescription by doctors. Luckily nowadays most of the doctors type it or write in capital letters so that that error can be reduced. Wrong medicines, wrong dose, all this I think the last one is look alike and sound alike. LASA we call it as. So that mistakes can occur from the caregivers. So we have to be very careful about that. Handwritten prescriptions. So these are nowadays not to be done at all. About the surgery safety checklist. Dr. Atul Gawande is an American surgeon and a very big research scholar who has done a lot of work on the patient safety and the surgical safety. So the World Health Organization has adopted his recommendation and has made a surgical safety checklist so that before the patient goes to the under knife, he is thoroughly verified and all the team members in the operation theater know what is going on, what surgery is going on. So this has reduced a lot of errors. So all of us follow the surgical safety list that is called 3 steps in that. Sign in, that is the before the anesthesia is given, a lot of things are checked in this box. So these are all to be verified. And before surgeon puts the incision knife, all these checklist has to be checked. And we can add some more if you want, if requirement of the institution, and sign out before the patient leaves the operation theater. Again, check all these things. So this checklist phenomenon has created very good safety for the patients who undergo surgery. So earlier, especially in USA, the wrong patients, wrong side, everything had to happen. So one of the famous thing was, you may be knowing that Sri Devi's mother, the brain tumor was on right side or so. The left side was opened and operated. So that became a very big issue. So such things are now prevented. So that happened in USA. So sanitation, infection control, biomedical waste disposal. Now we have a very robust system, I must say. Different colored bins to which we can put glass or syringes or needles, plastics, and the papers. So they have made the biomedical waste disposal very safe. You all may think that your hand is the most safe thing, but I must tell you, hands are the dirtiest thing in the body because we touch everywhere, including our nose, mouth, here, there, and they contain a lot of bacteria, fungi, virus, everything. So before surgery or before touching the patient, we always sanitize our patient so that otherwise we may infect the patient without our knowledge and without any bad intention. So to supervise all these things, there are health executives or the health hospital safety officer. Their role is very, very important. So they should ensure that a good safety culture is there in their healthcare system, in their hospital, and that once it is set, a health good safety culture, then all the other things will fall in line. With the accountability, what are the measures to be taken, reliability, communication and teamwork, professional development, all these are the responsibility of the health executives. One of the most important problem in the hospital when there are so many health care giving chain is the communication. So we always say communicate, 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 communicate properly. Not only communicate, whatever you have communicated, please document it in the hospital information system or the case sheet so that nobody can go wrong. So breakdowns in communication can result in the wrong treatment, a lack of treatment, or incorrect self-care by the patient. So it's very important that learning the communication skills and properly communicating it and also documenting it. So you may be knowing this story. It was a poem actually, story of somebody, everybody, nobody, and anybody. So this happens many times in organizations. So just to narrate, there was an important job to be done and everybody was sure that somebody would do it. Anybody could have done it, but nobody did it. Somebody got angry about that because it was everybody's job. Everybody thought anybody could do it, but nobody realized that everybody won't do it. So this was a poem written by Charles Osgood, but this is very, very true that the story of somebody, everybody, and nobody. So it is very important to allocate the responsibility, communicate properly, and then go ahead. So friends, measures needed to safeguard the patients in the healthcare facilities. This can go on and on. They are endless. It's a continuous process, ongoing project, and there is no end to it. It's everybody's responsibility. So everybody has to take some responsibility in this. Patient and relatives involvement is very important. Awareness and a good safety culture in the healthcare facilities and global alliance and knowledge sharing is very important. Have a safe environment for the patient. The patient is the center of the medical universe around which all our works revolve and towards which all our efforts trend. So this is what we want to assure you all, that patient safety is the top priority of each and every healthcare person. We all work hard for this. Thank you very much. Thank you very much, sir, for this opportunity. Thank you.
Now it's open for any questions, please. Go ahead.
Are there any safety audits in India in hospitals to show which hospital is better?
That way it is not done, sir. Each hospital does hospital audit, and there are accreditation organizations like National NABH, then all these organizations look into the hospital statistics and the medical errors, all the things. But comparing one hospital to another hospital, I don't think that is there.
But when they do accreditation, do they put a rank like they do it for colleges and so on?
No, sir, that is not there.
On safety.
Yeah. They just, yes, you are accredited, you are safe for the hospital like that. Ranking is not it.
Safety is not general ranking, about safety.
Safety. Correct.
So to me, if some hospitals are better, they can act as a role model for others, right?
It may come in the future.
Any other questions? Yes, sir. Please go ahead.
Yeah. Hospital acquired infection, I just briefly mentioned about the infection, sanitation, everything, is one of the biggest problems, especially like I'll tell you, you are putting a urinary catheter to a patient. Sometimes it may be required for the patient for surgery, or patient does not pass urine. So without our knowledge, if the proper safety precautions are not taken, we may introduce infection. So that is one hospital acquired infection. Similarly, if the patient is inside the hospital and somebody else is coughing somewhere or this thing, they may get a respiratory tract infection, upper respiratory tract infection. Or sometimes we put a tube to the lungs for the anesthesia or the ventilation, all these things. So those are all, infection can occur even with all the precautions, everything. They are all hospital acquired infections. So that's why I said hospital is not the safest place to go and stay like a hotel or something. It is a lot of activity happening. It's a place where there are all sick people. Even if good, healthy people have to visit, maybe it's better to wear mask and then visit and take care of your hands, touching. Even if you touch something in the hospital wall, that's it. You may see that always people will be cleaning all the rails, the lift, everything will be sanitized very, very frequently. The hospital acquired infection is a big issue, and there are a lot of measures, preventive measures, to prevent hospital acquired infection. Certainly, compared to earlier days, it has come down a lot. Yeah. Also, the wound infection, when you are doing a dressing and all, if you are not very good sterilization methods in the hospital, it can, wounds get infected. All these are hospital acquired. Yes, very, very true.
There is also the way medication is also as a research part is not taking that way in order to overcome this.
This is actually another big chapter, especially nowadays. These medical companies, they have almost stopped searching for new antibiotics because that's a very long process. 10 years, 15 years it requires to research and deliver a new antibiotic. Whatever existing antibiotics we have, especially because of the ICU where we have to use a lot of antibiotics, the organisms may get resistant. So resistant bugs are coming up. So what you said is correct, multi-drug resistant bacteria, fungus, all these things. So there we don't have much solution for that. So that's why each hospital has its own antibiotic policy, and also there is a infection control department. So hospital, there are now infectious disease specialists which are available. So if in our hospital, if I want to give some antibiotic, it's not allowed to give certain antibiotic. It has to be approved by the hospital infection control team or the infectious disease specialist. So that way we are preventing a lot of these drug resistant uh, bugs and all. But you imagine in India, there are so many hospitals, small hospitals, villages, everywhere. So everywhere you cannot have this system of the infection control team and the infectious disease specialists. So there are problems which have to be gradually solved, I think. So it's a very big issue, very big problem.
Out of box and this one. Though the antibiotic can it won't work with the multi-resistant bacteria, but still the patient will get cured. This is what I can you just put some words about that.
Yeah. So for the multi-drug resistant antibiotic infection, most of the time it is managed by the infectious disease specialist. So what they do is they will see the organisms which are there. There may be 3-4 organisms which are resistant. So they may use earlier with their experience and all, what is like colistin we have on antibiotic. So such things and make their resistance come down. So again, after a week or so, do another culture and see again what antibiotic is responsible, possibly act. So they have ways of, or stop all antibiotics for 4-5 days or a week, just observe the patient and then start again treatment. So they have certain guidelines to manage that can be managed.
Thank you very much. I think coming to answer some of these issues, the environment of the hospital equally important. He did mention the environment. I think this study has been done in Leeds University, the engineering department, medical department. Old hospital, you see the Victoria and also Care Hospital, Mysore, big hall, big windows. The air in the room has to be changed 6 times per hour. Circulation. That is the best ventilated. That's what he is mentioning about it. Now the modern way, what has come there is all a closed hospital and air conditioner to save energy. Some of the, if you need about 10 tons, you have to put 8 tons. Ventilation is less. So those hospitals have a 4 times more infection. This has been studied. So that's why we want to use our air, keep that Vastu, we call that. Based on Vedic mathematics, I think hospital has to be like that only. That's very much needed. And also another point is the communication is equally important. Another environmental related issue, it happened in 1977 in Philadelphia. The people came Legionnaire conference, like Rotary, and like a Legionnaire conference was there. 75 people, 150 people stayed in a 5-star hotel for the conference. Afterwards, a couple of days later, they developed a little cold, cough, fever, and all this thing. 30% of them died. They didn't know for 2 years what it is, why it is, and all this thing in the 5-star hotel. Later on, they identified some germs. There is air-conditioned duct. They have not maintained it. That's how it has come, that infection. They didn't know what germ it is, a gram-negative organism. That's what they named it Legionella. Legionella infection from the air-conditioned duct come from that one. Atmospheric, how is important, that's what highlighting. And the communication is very much important, was mentioned about it. When a doctor from the small nursing homes, friends to the corporate hospital, anything like that, they go there, how they receive is equally important. When they're taking the history, look here, your doctor sent all this thing. We like to do a test, then we'll get back to you. Look like he has got some problems. Then the relatives don't believe it. Oh, my doctor didn't say that he's a corporate hospital. They want to make money. That's what they're doing. These are all the values. People are talking about it. So when the results come, that is the stage of disbelief initially. When the results come, look here what you said. The results now it shows is this one. Previously it was like that. Now he has developed a problem. This is what it is. And then the anger comes. Why our doctor didn't diagnose early? Why didn't he send early? Then you then talk arguing about. Then I said, you brought your patient late. That is the end. They go and break all the hospital, previous doctor and everything. What to communicate? Look here, your doctor did the right thing. This is a dynamic process. This is what he sent it. That's why he don't have the facility. Sent it here. We like to manage it. Don't worry. When they say that, they will cool down. Then what happens? Then they compromise. A doctor, we have our relative in Australia, America, England, there, Canada. You get any one of the relatives, talk to them. They want to compromise. That is the stage. You come there. Then it is, yes, definitely we have all the facilities. If you need it, definitely we tap the resource. Don't worry about it. We'll manage. Then they feel happy about relatives. But later on, when you go, they make rounds, they're all depressed. We have been doing, doctor doing, why is not improving? They get depressed about it. They don't see eye to eye for the doctor making rounds. This you have to observe it. Then leave it alone. Explain what it is. You have to explain every stage. Last stage comes realization. Yes, they are doing their best. We are doing the best possible care. Somewhere you have to die about it. We'll do the best possible way for him. So stage of disbelief, stage of anger, stage of compromise, stage of depression, stage of realization. These are all the 5 stages will go in everybody's mind. It takes about minutes, hours, and days. We have to do that. Whenever the death happens, most of the people come, not the relatives who are their other relatives who came to sue and all this thing. They are the one fighting about it. Breaking the hospital, the furniture, whole lot of things. So we charge that much of thing. We say that you are not saved the patient. This is what it is. False belief and all this thing. Anyway, with all this thing, we covered all the 5 issues, what it is, way to manage it, how to manage it. We have to be cautious ourselves, how the environment hospital has to be maintained, and how ourselves keep free. And the indoor plants are usually good. Many people don't allow indoor. I think it's good in the hospital. All the formaldehyde, indoor pollution, they will take it, but they expose to sunlight once a week. With this thing, I'll sincerely thanks again for Shivaram for giving a wonderful talk. Well, thank you very much. I'll request Joshita Sankam to give the vote of thanks. Before that, we give the small token of appreciation from that. Professor Srinivasan to hand over the small token of appreciation. Sir.
Thank you, sir.
All this talk and all this thing, it will be recorded and it go to YouTube, and we have taken the permission, sir. Thank you very much. And we got a photo after this one, all of us.
Yeah, I'll just. So on behalf of the Vecha Center for Climate Change, I would like to thank Dr. Shivram for being with us here today. Thank you, sir. Thank you for the attendees for being here. Kindly join us for the photo session.
Sir, I'm working on something related. I know. But sir, I'm working on answer part of it, sir. Okay. Something called plasma activated water. Oh, I see. Sir.
That's a new research you have to.
Sir, we are exploring on that. We very recently we have filed a patent on that.
Very
How
good.
we can generate a water for mostly for this cancer and this multiple resistance pathogens. Hopefully, in couple of years it might be available. We don't know.
Okay.
Okay, I'll be really
Yeah, some cup of coffee cup.